Hi, I'm Dr. David Hill, and today we're going to talk about overnight cold sore treatment. I got bad news here. There really is not an overnight cold sore treatment. I wish that there were. What can we do for cold sores? Well, here's a little more bad news. I'm just full of it today, but I'm sorry, it's just the truth. The things that they sell over the counter for cold sores are forms of Zovirax that you can apply directly to the cold sore. Zovirax is a brand name for acyclovir. Now, this is an effective antiviral treatment. Cold sores are caused by a herpes virus, human herpes virus. It does not mean that it's sexually transmitted. In many cases, it is not. But the herpes virus has to respond to anti-herpes medications. The bad news is the stuff you put on the lip does not really seem to work very well unless you're immunocompromised. In patients who are on chemotherapy, have an immune disorder, or have HIV or AIDS, this medication may actually be helpful. But for immune-competent patients, it's really just kind of placebo. It's not doing you a lot of good. It's giving you something to do, but there's not a whole lot of evidence that it makes a big difference. So to treat those cold sores, you're going to want an oral version of an antiviral, anti-herpes medication. Now, the two of these there are that work the best are acyclovir, that's the older one, and valacyclovir, brand name is Valtrex. So if you're somebody who has a severe new cold sore, you've never had one before, and it's in the first 2 days of the sore, you may be able to go to your doctor and see if he or she thinks that medication will be appropriate. Likewise, if you're somebody who gets cold sores frequently, you know that every time you get sick or run down or don't sleep, you're going to get one of these things, your doctor may be able to provide you a prescription where you take it within the first 24 to 48 hours of symptoms. There is nothing to do for a cold sore after 48 hours have passed. We have no medication that makes a difference. You really need to stop the viral replication early in the process. But remember, acyclovir and valacyclovir can work early in the course of a cold sore. So talk to your doctor about it and see what you can do. Talking about overnight cold sore treatment, I'm Dr. David Hill.